for watching us again in the Community Health Education on Cable TV. Recently, many adults from our community has been concerned about the condition depression, especially some folks from the Chelsea Senior Center. So from them, we collected some questions of what they want to learn about depression. And today, we are fortunate enough to have a panel of clinicians from MGH Chelsea Healthcare Center that will help us to answer those questions. First of all, I'm going to introduce our moderator, Jasmine Hong, who is the community health worker at the MGH Chelsea Healthcare Center.
Thank you, Dr. Chen. It's great to be here. I'm here with our panelists, and I would like to have them introduce themselves.
Sure, I'm Jennifer Vetri, and I'm a dietitian at MGH Chelsea.
I'm Ada Aranianu. I'm a clinical social worker at MGH Chelsea.
Hi, I'm Dr. Hong Chen Cheong, and I am the physician champion for this community health education in cable TV. Glad to be here again.
Thank you so much. So I think I should start by asking, what is depression?
Sure. So depression is a little bit different from just a feeling of being sad due to a life event, such as someone dying. It's often a lasting feeling of at least 2 weeks long, and it's usually accompanied by some sort of physical change. So you might notice an increase or decrease in appetite, or you might be oversleeping or undersleeping. It can come in episodes. Sometimes there is only one episode in someone's life, or sometimes people feel like they have always been depressed. So women are actually 70% more likely to become depressed than men, but men too do experience depression. And actually in older adulthood, there's an increased likelihood of experiencing depression, and that can have to do with feelings of isolation or just a decrease in activities out in the community, so more time at home, and perhaps declining health issues. So it's something to look out for. Having a history of trauma, such as domestic violence, can also contribute to the chances of experiencing depression, as well as issues related to poverty or access to medical care. Having a family history of depression can also make it more likely that one will experience depression. And then additionally, there's medications that older adults tend to take, such as medication for high blood pressure, for example, or something like a broken hip or stroke, that have been shown in studies to correlate with an increase in experience of depression. So one thing to keep in mind is that the Latino community also has reported higher levels of depression amongst older adults, and that sometimes is related to language barrier issues, so the feeling of not being able to communicate what one's needs are, as well as often not seeking help right away. Sometimes depression can happen, just to wrap up, for obvious reasons, and sometimes it can feel like it just comes out of nowhere.
And what are some warning signs of depression in seniors?
So often you can look for real noticeable changes in sleep, for example, your level of interest in things that you were previously interested in, level of self-esteem, your energy can either go up or decrease, how fast or slowly you're thinking. A change in appetite is often a good indicator, and sometimes movement, if you're moving faster or slower. And lastly, your feeling of wanting to be alive. A common symptom of depression in older adults is the feeling of many aches and pains. So if you find yourself going to your doctor a lot with aches and pains that don't have a medical reason, then you might want to think about whether there's depression that you're also experiencing. Additionally, older adults can struggle with memory issues and the experience of things or fears that you did not previously have before. So for example, suddenly being afraid of a routine grocery store shopping trip and not knowing why you're afraid of that can be a sign that you're experiencing depression. Sometimes people tend to not identify that they have depression and self-soothe with activities like drinking or other such activities, and these tend to not actually help with depression and can be harmful.
So how does one know that one is depressed?
So, okay, thank you, Ada. I think that
Yeah.
those are like really great information, and that is based on that. Usually, we do not have specific tests for depression, but more like a history taking and getting the signs from the patient. So it's very important for you to go to your doctor when you notice one of two things: a diminished interest or pleasure, or feeling down or have a depressed mood for more than 2 weeks, plus all the signs that Ada have mentioned, like moving too fast or too slow, having issues with sleeping either too much or too slow, having inappropriate sensation of guilt, not feeling that one is good enough, many of other symptoms like losing the memory, unable to focus or concentrate, all this variety of symptoms. It also depends on different causes of these symptoms, so we will, at the same time, the doctors will try to check for other diseases, either from causes like medication, or sometimes there are another metabolic procedures that is happening in the different chemicals inside the body that we can sometimes check, but usually it's based your medical history. So it's very, very important that you, if you feel something, share it with your provider.
And what treatments for depression, like medications, for example, exist, and what are their side effects?
Yes, thanks. A lot of people first think of medication, but usually we manage depression with a multimodality approach. So it's not only like medication that we use, but more importantly, we also counseling to be surrounded with a supported environment, and a healthy lifestyle is very important for us to manage the depression. Talking about medication per se, we use different medicines that can manage or adjust some chemicals inside our body that is called neurotransmitters. The most common one that we have used is for attack for the serotonin, and people can have heard names like citalopram, paroxetine, sertraline, those medications. Other neurotransmitters includes the norepinephrine as well as dopamine. Many of these medications also can help for the pain or lack of energy that we have. So we have heard medication as like Wellbutrin that has been used for smoking cessation, and the duloxetine that can help for back pain, which is one of the main symptoms that kind of like make our life a little bit more difficult. Besides of that, if that doesn't work, doctors tend to add another medication. Again, we need also the different exercise and counseling, but if none of these work, other medications include the tricyclic antidepressants, as well as the some another monoamide oxidase inhibitors. But these are older medications, as well as some antipsychotic medications that has been used, and they are like older medication and has a slightly more adverse effects, including having like abnormal movement, like moving the tongue like that. Some of the blood pressure might be higher, and some of the interaction of these medications can alter a little bit the heartbeats, but it will depend, of course, on the previous condition of the patient.
And are there any treatments without medications?
Yeah, so if you think you're experiencing depression, a really good place to start is to go talk to your primary care physician. And as well, if you're an adult child taking care of an older adult or a parent, it could be really helpful to support your older adult in that doctor's appointment and talking about the symptoms that you're observing. Treatments can, just to elaborate a little bit more on what Hong said, treatments can include anything like seeking out counseling, participating in activities outside the home, engaging in more regular exercise, or seeking out things like meditation or prayer or religion. There are a lot of different kinds of therapy. Just to give you an idea, you can be part of group therapy and meet other people that are experiencing similar symptoms and share different ways of improving your mood, or one-on-one counseling can also be really helpful. One thing that's important to keep in mind is that change doesn't usually happen overnight. So it's really important for anyone seeking treatment to be patient. And then the sooner that the treatment starts, the better your outcomes are likely to be. Many people achieve a partial or complete reversal of symptoms after seeking out treatment.
Can we talk about how nutrition can affect our moods?
Of Of course, there's a strong connection between food and mood. The foods that we choose, they affect our health, they can affect our energy level, and they also can affect our mood. And the opposite is also true. Our mood can affect the types of foods that we choose. And oftentimes when someone is depressed, they may find it more difficult to eat well. For example, they might find themselves eating more or less than they usually do, or they might find themselves craving more sugar or fat. But everyone is different, and our emotions affect the types of foods that we choose in different ways. We know that a healthy diet can help boost or improve our mood.
So, can we still live a healthy life with depression?
Yes, of course, absolutely. As Jennifer just mentioned, like we have to eat food, and food can help us to boost our energy. But also, as Ada mentioned, we have to make sure to surround us with positive people, with a very supportive environment. Find providers that can give you that support and that encouragement. It's not the time to be alone. It's time to seek out for help, because we're human beings, and that is why we need to exercise our humanity by joining other people. We can go to different activities. If you're religious, go to church, your support group. If you find meditation helpful, look for instructions for that. Go and have exercise, make your body feels the energy, and always tell yourself that you're worth all this energy that is spent in yourself, because you're going to be healthy, but look for help.
How do anxiety and loneliness interact to affect our health?
So anxiety and depression can often come together, but they can also come separately. Loneliness can be a cause of anxiety and depression, or it could result following one's experience of anxiety or depression. It is really helpful to have supportive people around. When that's lacking, opportunities like seeking out things like attending church or participating in group therapy can be really life-changing to someone struggling with depression.
Yes, and actually recently an article that just came out in March in the Journal of Academic Nutritional Diet came out that depression, which a lot of time is the root of the anxiety and loneliness, have shown to associate or predict that people will have more diabetes, will have more weight issue, and actually their diet quality has shown to be decreased. So these actually affect in real life our own health.
Very good. Is forgetfulness linked to depression?
So forgetfulness is often a symptom of depression, especially amongst older adults, but it's also just a symptom of aging. So if you're experiencing forgetfulness, definitely talk to your PCP and identify whether it might be due to depression and not dementia, for example. There are many treatment options for addressing forgetfulness. However, few exist that can completely reverse memory loss. So speaking to your doctor about your concerns early on can be your best bet in finding solutions that prevent future memory loss or forgetfulness.
Yes, forgetfulness, and people get really scared that we might be having dementia, and that's something that sounds really bad. But remember that depression can be confused a little bit with dementia, but at the same time, even if we have dementia, treating the depression can help us to decrease our symptoms.
Now, let's talk a little bit about how to prevent depression. Is there a list of foods that we could eat that would help with preventing depression?
Yes, well, there are no specific foods that prevent depression, but there are foods that have been associated with improved symptoms of depression. For example, fish, especially fatty fish, like salmon, is rich in omega-3 fatty acids. Omega-3s are important for our heart and our brains, and studies have shown that omega-3s help to improve symptoms of depression. Fruits and vegetables are excellent sources of vitamins and fiber, and studies have also shown that individuals who eat 7 or more servings of fruit and vegetables every day tend to be happier. Protein-rich foods like turkey, eggs, and almonds have tyrosine, which is an amino acid that helps the brain to produce dopamine, which is our brain's feel-good chemical. And including a little bit of protein at each meal and snack might also help to improve mood. Vitamin D rich foods like sardines, mackerel, milk can also be connected to depression. Many studies have shown that individuals who have low levels of vitamin D have increased symptoms of depression. Our bodies also make vitamin D when exposed to the sun. So getting outside a little bit more, going for a walk, for instance, can help. And we know exercise alone can help to boost our mood. And finally, B vitamins, including folic acid and vitamin B12, have also been linked to depression. Individuals who consume lower amounts of these nutrients tend to have more symptoms of depression. So increasing foods such as beef, beans, poultry, certain fruits like cantaloupe and bananas, and green leafy vegetables can also help.
Does sugar play a role in depression?
Sugar definitely can play a role in depression. Often what happens is when someone is depressed, they might find themselves craving more sugar and as a way to increase their energy. And this is never really a good idea because it often results in a quick burst of energy, but then a bigger crash. So instead of foods like candies and drinks and sodas, we want to really try to choose more whole grains like whole wheat pasta, brown rice, whole grain cereal, for instance, because that'll last, that'll result in a longer energy, really.
Thank you so much.
Yeah, I wanted to add a note about preventing depression. I think it's really hard to prevent per se the depression, but understanding your own risk is very important. Like as Ada mentioned, understanding that you had a family history or that you had a history of trauma. Also, there's days that we can feel worse. There's a disorder that's called seasonal mood disorder, where people find that during winter time when there's lack of sun, or during holidays time or dates that are important for them, they find themselves more sad. So being aware of that and seeking for special things that make you feel good, like surround yourself with friends and family, looks for the sun and going out groups. And some people can even find some of the light bulb that helps to supply some of the rays that the sun apport can help to decrease the symptoms of depression.
What is a final word that you would like to share with our viewers?
I would just like to say, as far as nutrition, that diet can really play a role in preventing depression and our mood. We know that when we tend to choose healthier foods, we tend to feel better about ourselves and have improved energy. So trying to increase these foods while decreasing these foods can really help us.
Yeah, I feel that like we should be mindful that we're not talking about trying to erase one of our feelings, this one part of our feelings. And I think it's important for us to remember that we want to have different emotions, but use this opportunity when we're more sensitive and vulnerable to connect to our inner longings and our own needs, so we can reach out for feelings that can make us as human. Like, for example, feeling that we have someone to love and having people that love us, and also being able to be happy for others and looking for people that can be happy for us.
Exactly. And I would say just lastly, depression is treatable. So you don't need to continue to struggle with depression on your own. The sooner that you seek help, the better your outcomes will be.
Okay, I think that's it for today. Thank you very much, Jennifer, Jasmine, and Ada. I really hope that you can find some answers here, that you have found this information helpful. We really appreciate you watching us, and we hope to get more questions from you so we can continue to help to improve the health of our community. And we hope to see you next time again.